And finally, question number 10. Why in the world do patients travel from far away to come see us from all four corners of the continental United States, from all over North America, and from all over the world? Well, I think it's because the YouTube algorithm has brought you to one of our videos. And a lot of patients have found us that way. But importantly, are we worthy of the journey that those patients take? I would say absolutely yes. Why is that? Because we have devoted a Herculean amount of effort to develop an elite team of ophthalmologists, optometrists, nurses, technicians, and administrative staff to deliver an exceptional customer experience and to deliver the very best surgical and medical eye care, period. Also, we're experts in premium lens implants. We've placed tens of thousands of premium lens implants over the years, and we know their strengths and their weaknesses. And remember, there is no perfect lens implant. Every lens implant can have potential side effects that you might notice, and which might give you reason to be dissatisfied with how you see. It's our goal to work with you to manage expectations, and then if we jointly decide to do additional surgery to optimize your vision, that we keep it real, we disclose everything good, bad, or different about the surgery that you're going to potentially undergo, and we make sure you have a realistic expectation going into surgery so that your outcome is as good, if not better, than what you expected going into surgery. And because we've placed tens of thousands of these premium lens implants, and we've had to work with patients who were unhappy with their visual outcome, which tends to be about 1 to 2% of patients who receive these implants. They don't like the way they see for some reason. We've had to work with them to solve their problem that they're experiencing after surgery, and that has involved different types of lens exchanges or doing LASIK after premium lens surgery, or any number of corrective surgeries to help bring a patient into their best focus. Now, sometimes even we can't fix you. Sometimes we have to refer you out to another super subspecialist, or we may just have to level with you and go, you know, even though you're not seeing as perfectly as you want, this is why, and I think you should just leave your eyes alone, not have additional surgery, and if you need to see your best, maybe a contact lens or glasses is your final best solution. How often do we do intraocular lens exchange for patients who've had surgery elsewhere who come to see us and they want to have their first lens removed and a different lens placed? It's pretty much every week. And finally, let me just say that we have outstanding staff and outstanding facilities. We have our own ambulatory surgical center at our Westlake office, and we have our own LASIK suite also at our Westlake office. In conclusion, let me just thank you for investing your time in watching this video, and I hope it helps answer some of the most commonly asked questions we receive for patients who want to come see us for a surgical consultation or a second opinion. Have a wonderful day. Bye-bye.